For those who recently joined, we're just waiting for the attendee list to fill in. We'll give it a few minutes and get started. Thank you so much for coming. Clinics and hospitals. More so, this is a call to action for our students, for staff, seasoned professionals alike, to refine our voices, sharpen our skills, and make a meaningful difference in healthcare. As Muslim biomedical professionals, we are uniquely positioned to lead with empathy and integrity. And our goal today is to transform our passion into actionable change, learning how to effectively advocate for patients, speak powerfully to public officials, and drive policy reforms. Our focus on the Gaza case study will illuminate what authentic advocacy can look like in the face of adversity and offer invaluable lessons for resilience and justice. So thank you for joining us in this vital endeavor, not only to walk the talk, but to lead with courage and conviction. Together, we'll champion this cause of equitable healthcare and amplify our collective impact. So it is really a huge pleasure. And just to tell you all about the MPAN, the Muslim Healthcare Professionals Advocacy Network, we're a program under CARE, who we've seen a lot of lately in their brave defense of Palestine and the rights of protesters in the US. And our aims are to mobilize healthcare professionals towards interactive legislative processes, policy making, and the intersectionality between being Muslim and healthcare as a civil right. We also hope to build this community of Muslim advocates in the healthcare industry. I want to quickly shout out Dr. Sondas Al-Saad for starting this great initiative and really being the impetus that has pushed this group forward. She's a wonderful woman in medicine, Muslim woman in medicine, who's been leading us. Some of the strategies are we focus on legislative processes under the auspices of CARE. We train professionals to authentically engage in civic processes, and we hope to collaborate with more groups. If anyone's interested, here's a QR code. If you're tuning in from your phone, you can take a screenshot and access it later. And there's also a link. Both of these lead to MPAN's mailing list, from which you can further get involved and even join us for meetings if you'd like. Oh, so sorry, I clicked on the link by accident. Oh, and here I am. Quickly, a few things about me. I'm the moderator. I'm a Muslim Lebanese American. I'm from the East Coast, moved to the West Coast, and I'm doing an MD PhD program. So it's a privilege to moderate three amazing Muslim women today who I'd like to introduce, starting with, let me pull this up quickly, Dr. Khaira Bakaja. Khira Bakaja is a Muslim Algerian, or Khira Bakaja is a Muslim Algerian American born and raised in Northern Virginia. She's a senior at George Mason University, passionate about creating meaningful spaces and building bridges, literally by studying civil and infrastructure engineering, and figuratively by empowering individuals to create the change they want to see. Khira is a congressional advocacy trainer with the Polygon Educational Fund, a national nonprofit organization that fosters meaningful and long-term relationships between the Muslim community, allies, and members of Congress. Khira's work with Polygon, the Muslim American Society, and the Muslim American community highlights her firm belief that political engagement should extend beyond those pursuing legal careers or related fields. So it's a big privilege to have Khira here today. Our next panelist would be Dr. Sana Sayed. Dr. Sana Sayed, MD, MPH, is a Muslim Pakistani American serving as the president of the American Muslim Health Professionals, AMHP, and is a neurologist by training. She's currently working as a global clinical lead at Sanofi US and a teleneurologist for NeuroX. She trained in neurology at Boston Medical Center and completed demyelinating disorders and cognitive neurology fellowships at Beth Israel Deaconess Medical Center in Boston. She also holds a master's in public health from the Harvard Chan School of Public Health. In addition to being part of AMHP, Dr. Sayed serves as the advocacy moderator for the Women Neurologists Group. and a committee chair for the Rare Diseases Diversity Coalition. As a health professional, she has been actively advocating for healthcare reform as part of her work with the AMHP, as well as with the American Academy of Neurology. She also spearheaded the policy and advocacy work with the National Muslim Task Force for COVID-19 with partner organizations. She's a strong believer in civic engagement, and truly collaborative efforts of advocacy is what she believes in. So, Dr. Sana, it's great to introduce you to the panel. And our third panelist is Dr. Hala Sheikh Ol-Islami. Hala Sheikh Ol-Islami is an Iranian-American family physician who has been practicing in the Bay Area for the past 28 years. She's currently doing integrative medicine consultations at Sutter Palo Alto Medical Foundation. She's worked in various medical clinics, including community clinics and homeless clinics, to be able to serve the underserved population. And she had a life-changing medical mission trip to Gaza in May 2024. So big welcome to all these panelists. And the way that the event will work, we can move here. Here are actually the faces of these panelists. And if you'd like to follow and amplify them. The way that the panel will work is we'll do a presentation from each of them for 15 minutes. They'll share their expertise with you and all the cool things they've done. And then after this, we'll move on to a question and answer period with the remaining time we have left. And without further ado, I want to double check that everyone can see this first slide. Everything good? Okay, then we'll leave it to Khira.
All right, Bismillah, everyone. Thank you so much, Kamel, for the warm welcome. I am not a doctor, not even close. I'm in the engineering world. But thank you again, Kamel, and thank you for everyone in the audience for taking time on your weeknight to join us, inshallah. So my goal for today, I want you all to leave feeling empowered that even though I'm not in the law field, you all are not in the law field or in the law world, but you all have so much to offer when it comes to political advocacy. So I think my greatest mission here is for you all to know that political advocacy does truly extend beyond those who have careers in the law or policy world. Everyone's voice matters. So if you take one thing from today is to not underestimate your voice, your experiences, and your perspective, inshallah. So we can move on. So inshallah, here today, I'm on behalf of the Polygon Education Fund. So they are a national nonprofit where the goal and the intention is to support and empower the American Muslim community by equipping them with knowledge, tools, and access to participate in the legislative advocacy world. So towards the end, actually, they send out weekly newsletters on bills to consider in your advocacy events, what to keep up with in the news when it comes to Congress and how to stay informed. So the ultimate goal that Polygon wants is to equip the Muslim community to help amplify Muslim voices in powerful places such as the State Department, Congress, and the White House. Next slide, please. So before I start off, I do want to acknowledge that I think we're in month 10 right now, 11, almost a year in October of the genocide that's going on. We're bear witnessing to atrocious manners and what we're seeing in our world. And this is all funded and supported by our own government. It is enabled by Congress with our own tax dollars. So me having this conversation with you all, I know there has, within my Muslim community here in the Northern Virginia area, there has always been so much pushback when it comes to connecting and working with Congress. And I do want to say that I completely understand that, you might think that your efforts are not making an impact, or, just yesterday we saw that, Biden is the White House and Congress are willing to send over more aid. So I do want to emphasize that your efforts and the work that you are doing is not going in vain. And we will talk about how you can continue being part of the solution. And I just wanted to start off by a hadith from Prophet Muhammad sallallahu alaihi wasallam, and us as Muslims, He says that whoever of you sees an evil, let him change it with his hand. And if he is not able to do so, then let him change it with his tongue. And if he is not able to do so, then with his heart. And that is the weakest of faith. But inshallah, we are able to do so with our hands, with our tongue, with our resources, with our power and privilege. I also want to emphasize that we live in the United States. We live in a country that is directly impacting what's happening overseas. So please don't underestimate your power, even though you might not see like it's not making a difference, but it is making a difference. Inshallah, next slide. So you might be wondering, why am I talking to you all? Why is advocacy important? And the way I like to think about it is, if you want to create change, or if you want to see something that is not part of the status quo, you can't just sit back home, complain. Going to protest is very important. Also, outside of like the advocacy world, I do a lot of like organizing and making sure people are out in the streets. But getting out to the streets is not the only thing you should be doing. In addition to going to protests, connecting with these political appointees is very, very, very critical. So being in Northern Virginia, I'm only like 20 minutes away from DC. So whenever I can, whenever we're able to have these meetings, I try my best to go to Capitol Hill in person. And one thing that I have personally noticed with my eyes is that the Zionist lobby is on the Hill every single day. And they have been on the Hill for the past 50 years and plus. So you can only imagine that connection they have with our congressmen and our senators. So the reason why advocacy is important is because it's the only way we can get our point and our perspective across. And honestly, when our community is united and strategic and like moving in the right direction, people will listen to us, and they have been listening to us. Like, if subhanAllah, many people say that, our phone calls, our protests are not making a difference. But the truth is, many of these elected officials, and we actually had both senators from Virginia, they told a few of our like key Muslim leaders within the community that they are not sleeping at night with everything that's going on and the public pressure that our community is putting on them. So again, your efforts are not going into vain. And also another thing is, us as Muslims, we have the concept that, we might not see our change within our lifetime. It's not something that takes like 24 hours. Like I said, the Zionist lobby has been on the Hill for the 50 years and plus. And us as a community, we have definitely, built bridges and have come a very, very long way. But just recognizing that the opposing side has had a greater connection and has put in so much effort and time within these elected officials. So just keeping that in the back of our minds. Inshallah, next slide. So when we think of sources of influence, the first thing that everyone comes into mind is APAC. The only way when it comes to like Congress or making a solution with the United States is, money. That when it comes to like the most impactful people are the people with the most money, which yes, in hindsight, that is very true. But another huge important and part of like influence is people. So the next slide will cover, constituents. But in addition to like the interest groups such as APAC, when it comes to like money, people's voices are very, very important. And we have seen, organizations such as the American Muslims for Palestine, or even CARE itself, organizing and bringing their constituents on the Hill. So when it comes to power, there is money and there's also people. So two things that define power: money and people. Next slide, please. So definitely our Muslim community does have money and does have resources, but I would say the most important thing we should capitalize on is the constituents, which is you as healthcare professionals, as doctors, or honestly, just as individuals, as constituents, not even individuals, and recognize that you, the constituent, are the one who elected your congressman and senator into office. So you need to put that hat on that you're the one who put them into office. So just keep that in the back of your mind. Whenever someone tells you, oh, like this doesn't make an impact or it's not important, remind them that you voted them into office and they have a great chance of not being voted into office next. This is something you will not hear on mainstream media, you know, with Biden dropping off from the race. Like that was because of the uncommitted vote, the people who are continuously marching the streets every week, who have been calling day and every single day to their congressmen and senators. Mainstream media will not tell you that the reason why Biden dropped off is because of the Arab or Muslim vote. They won't say that just because they don't want us to know that. But I want you to know that your voice is making a difference. Next slide. So yes, this is direct quotes from a congressional staffer. We're saying that direct constituent interactions have more influence on lawmakers' decisions other than strategies. There are so many bills that come into these offices, but the only key ones that make it to the floor are the ones that the constituents call their elected officials and tell them, we want this to happen. So this is why like direct interaction is very, very important, whether in person, via Zoom. I know many of you are out on the West Coast. Setting up virtual meetings is a tool. It's a way, instead of flying out to DC. Also, your elected officials have times where they go back to their home base office, which is your city. So you can meet them when they're back home. You don't have to fly out to Washington, DC. And then also you can send them phone calls or send emails. Next slide, please.
So sorry, did you say next slide?
Yes, yeah, next slide.
So sorry, I think my
No,
audio
you're
cut out.
good. You're good. So the biggest question that I know everyone is, we're all feeling hopeless and it's like, okay, what can we be doing? This is also another perspective as to how like your constituent advocacy works. And these are stats from the Congressional Management Foundation, so directly from staffers on the Hill who work in these offices. And they're letting us know that 94% of congressional staff believe that direct constituent contact influences undecided lawmakers. And then also using your personal anecdotes and experiences and your expertise as healthcare professionals will only make that persuasion come to another level. So it's very, very important to just voice your story, voice your opinion to your elected officials. Next slide, please. So just a quick refresher, next slide. When it comes to the legislative branch, you have two chambers. You have the Senate, which we have 50 states, so 2 members per state as your state senators, and they have 6-year terms, versus your representatives, that is deciphered based on your respective district and where you live. Keep in mind that your representatives have 2-year terms, which means that after every 2 years, they have to be thinking about, okay, my next cycle of re-election, I have to be sure that I'm listening to my constituents because they need us, they need our vote and they need our money. So your representatives are like people you should be calling on a daily basis. And we'll talk more about like getting actually into contact with them. So really notice that difference between a 6-year term versus a 2-year term. So you have a lot of influence with your respective congressional representative. Next slide, please. So this is how it works, how a piece of legislation becomes into law. First, the bill is introduced, and then it is sent to the respective committee. There's a whole list of committee. There's like a committee on transportation, committee on healthcare, education. So even though you all are healthcare providers, there's a whole committee for just healthcare. So your voice really matters. And then next it would go to either the House or the Senate based on who introduced it. And then the 2 chambers will reconcile. They will try to package it, and then they send it to the president, who will either sign or veto. You have been seeing recently there is definitely bills, and then there's also resolutions. You've probably seen CARE put out messages being like, call your elected official and tell them to sign on or endorse this resolution. A resolution is not binding. It is just a powerful statement to highlight what your congressional representative or senator represents. Like that's their ideal. So currently right now with Gaza and all of the atrocities that are happening in the world, we see more of a push toward resolutions. But we're also seeing the call for law. There's like the National Security Memorandum. I know Virginia's senator was one of the co-sponsors on that. We are now asking for an arms embargo where we want to actually see law and bills put in place. So just keep that in mind. There is a difference between a bill and a resolution. Next slide. This is just the hierarchy. Typically, when you're calling on the phone, so something that we have been doing here in Virginia as a grassroots effort, and actually it has grown to be a national effort, and we'll be sure to, I'll send the information for everyone to join the respective WhatsApp group based on your respective state. What we do is every single day, we send out reminders to our community to reach out to the 2 senators and your respective congressional representative. And we're just calling them, letting them know. And typically the person who's picking up the phone are just the staff assistants or the interns, starting from the right to the left. And then, you're just letting them know that this is who you are. I'm a constituent and I'm calling, asking for a ceasefire, an arms embargo, sending more humanitarian aid, whatever it is that you want. This is your way to directly communicate with your office, is by just calling them. And the person who picks up the phone is a staff assistant or an intern. And I'll say this, I know it has been very, it's been very disempowering to call every single day and see no change or see no impact, but there is an impact. But something to keep in mind is that even as Muslims, our Islam is based on our akhlaq, our actions, how we carry ourselves. One thing to know is that I do have some close friends who have worked their ways up to being, chief of staff and legislative assistants. Just know that people who start off as staff assistants or interns typically work their way up to be the press secretary. So the way you speak to them on the phone really, really matters. And I know it's a very frustrating time, but this is just something I wanted to point out, that the way you speak to people on the phone, they will keep note. And especially if you're calling them every single day, which you should be. Next slide, please. Okay, to find your representative, remember, we said there's 2. There's the Senate. We know that we have 2 standard senators that are with you for the 6 years, but your representative is based on your House district. So if you just go to house.gov, put in your zip code, your representative will pop up, and his phone number, his email, and his office. So you all can do that on your personal time, but that's how you find your representative. And that will differ based on where you live. Next slide. And same with your Senate, you can just go online and be like Virginia's senators, and you'll see them, California's senators. And that's universal for the full state. Next slide, please. So once you have identified your member and your senators, on their website, they have their phone number. And I would actually advise that you save this number to your contact list, because you should be calling them every single day, letting them know what you want in a polite manner. And I know CARE, and I know based on each respective state, there's tailored asks, but the main ones right now for Palestine and for the genocide in Gaza is, arms embargo, immediate ceasefire, and more humanitarian aid. We've seen this everywhere. So once you find their phone number, you can call them, or you can send them an email. Sending them an email requesting that, hey, I am a doctor, or I'm a teacher, or I actually have family in Gaza, and I would like to set up a time to come in and speak into your office. You can do that via email. Next slide, please. And the next slide will have more information. This is just to track bills. This is very, very old. Back in like October, November, we were still talking about House Resolution 786. As you can see, we're still asking for a ceasefire, but we're going to continue doing our efforts. I personally do not call and say House Resolution 786 because some senators and congressmen just do not want to sign on to that. And it's a little bit old, so I would personally recommend just saying an immediate ceasefire. And they know what to do with that. Next slide, please. I will speak more to the how to office visits, as that's like what's most pertinent. So once you have, established who your senators and your representative is, schedule a meeting. Literally go on their website and they have a whole, some offices might have a whole tab where it says fill out this form to schedule a meeting. And they make it very easy and accessible. And as I would say, leaders within your community, refer back to your masjids, so I'm also involved with the Muslim American Society, and within the mass chapters, we have PACE teams, which are the public affairs and civic engagement teams. So reach out to your masjid, and it doesn't have to be a mass masjid, any masjid, or whether your school, and put together a team of people, probably 5 people, no more than 6 people max. Bring a team together, identify a facilitator, a leader, and reach out to the office. Be like, we have a group of concerned constituents and we want some time to speak with your office. The first time you will not speak directly to the senator or to the representative, but you will be speaking to their staffer, to their foreign affairs staffer. And I know sometimes in the community, some people like immediately want to speak to the senator or the representative. But one thing to note is that the foreign affairs and staffers are the ones who are working on the policy briefs of your representatives. So sometimes meeting with them is way more beneficial than meeting with the senator themselves directly, because they're not the ones who are working on their policy. So I would say my biggest advice to you all, and we'll be sure to share this, so this is a resource for everyone, is create a team. Find a team of people, whether it's your colleagues or if your students, whoever it is. Find a team of 5 and designate a role for each person. Have one person reach out, schedule that meeting, or even as you're making your daily calls to the offices, speak to the staff or be like, what's the process to schedule an in-person meeting, whether in person or also virtual as well. Know that option is available. And then in terms of talking points, there are multiple talking points online, and I'm happy to provide in the follow-up email, but personalize it. The personal stories are what gets to the office way more than just straight up facts, because these people are following the news. They know what's going on. Also, if you can have, care, or let's say medical groups come in and show, whether it's documentaries or screenings, show that. Try to go with an organization. And I would personally recommend to not go on your own. Try to set it up with an organization, because oftentimes you'll get a meeting easier if you say you're going with CARE, SFB, or if you're going with Mass, San Diego. It might be easier to schedule a meeting with an organization. And then always follow up. That's way more important than the meeting itself, because the intention of setting up these meetings and for these office visits is to build a relationship, establish a relationship with your elected official. And this is not something that you do once and you stop. It's continuous effort. Remember, the Zionist lobby has been doing this 50 years plus. We can't do one meeting and then not talk to them for the next 6 months and then bring it back up when there's something that we need them for. So it's just about building that relationship. Next slide, please. So I do have a few points. I would say a major point to also remember is that federal advocacy is very, very important, but don't forget your state house. So I know many of you here might be from, California. I looked into when your state house start the legislative session, and that's only between January to March. So it's a very, very short time frame. But believe it or not, the process of getting legislation on the floor starts now. So reach out to your local masjid or your CARE chapter and ask them, what is being done to reach our state legislators. So in addition to your federal senators and congressional representatives, you also have your own state Senate and state House rep. Similar to the federal chamber, you have that on your state level. So the same thing. However, their legislative sessions are just much shorter and much dense. So if you can start establishing relationships with them right now, and believe it or not, your state advocacy sometimes is way more important than the federal advocacy, because the state is the one that's putting down rules against whether to implement anti-BDS legislation or not. And I believe California is not on the list yet. I said yet because we never know what happens next year, where they could partially, potentially, I hope this doesn't happen, become one of the states that do not allow BDS legislation. Also, you know, the state house and Senate, whether when it came to like the student encampments, they were the ones who, your governor, were the ones who were deploying your state troopers on the students, on the public institutions. So don't underestimate the impact of like local advocacy, whether it's like with your school board, your state house, or your state senate. Just looking over my notes, I don't see that I didn't miss anything. I would say like one last point is that I know I mentioned this, that our efforts are not going into vain. And especially when it comes to legislative advocacy, it's definitely difficult to have conversations with our community, seeing every time we call, we're still seeing money and troops and, you know, weapons being sent with our own efforts and our own money. But I will say this, like when the day comes, Allah won't ask us if you freed Palestine or if you were able to stop this. You will be asked for your efforts. So just keep that in mind. Keep doing what you can and make it a consistent habit. So whether you're calling every single day, by the way, the calls only take 5 minutes, especially if you save the phone numbers. You should be making 3 calls, 2 senators and 1 congressional representative every single day, Monday through Friday, and try to organize groups to go to their offices, to physically visit their home office. Or if you have the opportunity, the US Muslim Council of Organizations, CARE falls under that, MAS, ICNA, MUNA, all of these national Muslim organizations, they plan a annual advocacy day on Capitol Hill. We just had it this past April. And I believe it overlaps with California's State Advocacy Day, Muslim Advocacy Day. But I did meet a few people from California who came down to DC. So know that there are already groups who are setting up these meetings. So just try to interconnect yourself with that community. And again, like I just cannot emphasize that your efforts are not going into vain. Like with Netanyahu's arrival here in Congress, there were about 100 plus senators and representatives who declined that invitation and did not show up. If we had the same conversation 2 years ago, it would be significantly less people who would have declined his invite. And the reason why these senators and representatives did not show up was because our voices. We showed up on the streets, we called, we showed up to their offices, we even showed up to their homes as well. So here, like I said, not being a policy expert is an advantage because they are really looking at your perspective as a fresh and valuable perspective. Sometimes they can get a little bit annoyed by the typical lobbyists that they see every single day. So know that your experiences and your skills are a valuable asset. And don't underestimate the power of like storytelling. And yeah, and feel free, I'll share my email as well. Polygon is a resource. And like I said, every single week or every 2 weeks, they're sending out bills and legislation to keep an eye out. So in terms of talking points, they've got you there. There's a lot of support out there, and same with CARE as well.
Thank you so much, Hira, for actually that really, not just practical, but empowering pieces of advice. And I think we all look forward to putting these into practice. I think you've reworked a lot of how my future advocacy would look like. So here, we'll send out the slides, but here are the socials. And we'll kind of move on to our next panelist. Dr. Sayed, after you.
Okay, thank you, Kamal. And thank you, Hira, for the excellent presentation. As Kamal said, I am the president for American Muslim Health Professionals. I'm going to give a brief overview of what we do in the advocacy space, and also just highlight how we're pivoting to try and incorporate the messaging around Palestine and the work that we do. I just want to emphasize we're a domestic organization. and slightly smaller in size. But in any case, Cameron, if you can go to the next slide. And I will also touch on why, as a health professional, I think that this is imperative. So what we basically work on, our mission is that we bring together and strengthen the impact of Muslim health professionals to improve the health and wellness of all Americans. And we have three main domains in which we work: professional development, mental health, and health policy and advocacy. Health policy and advocacy is what I will focus on. If you go to the next slide, please. Um, so in anyways, let me just highlight a few things on health policy and advocacy before I delve into these points. Our work is mainly on healthcare access, on health equity in the US, and our work centers also on uh, social determinants of health in the US. But just to give you an example, like we take the principles that Khaira was talking about, setting up meetings, calling, and also action alerts are something that we do. And we take bills that are relevant to domestic healthcare, and we speak to our representatives through these different forums, whether it's email, whether it's in person, whether it's through drafting letters to engage with the community. But now, with everything that has happened in the last almost 1 year, for instance, we're working on a maternal health bill called Momnibus. Throughout that, we've weaved the messaging and explained how it is imperative that we also think about the Palestinian mothers, because when you need health equity in the US, you need health equity everywhere. So we have been trying to weave that message in. And personally, I will say, like Khaira mentioned excellent points and talked a lot about all the different ways and avenues in which you can do advocacy. I also think that sometimes we feel overwhelmed. Well, I have to call this person, I have to draft this email, I have to request a meeting. What if I'm not available? What if I have clinic? One way that I found was that I signed up for these action alerts on Resist Bot Watermelon, and they just text you on your phone. They write letters every day. And I've been signing a letter every day since, well, November for sure, when I discovered it. So you can send an email every day, and then my engagement has been that some of them reply to me. And then I send them links, and I send them the ICC ruling, and I send them the investigations that have been done by the UN rapporteur. And I've been like highlighting their lies, basically. I'm very, very blunt about fact by fact check. I do it in writing with them. I have repeatedly told them that I will never vote for them, considering their Zionist stance. So and why do I do this? I mean, honestly, as healthcare professionals, we have a privilege. We have access to data, and we have personal stories. We have seen the healthcare infrastructure in Gaza decimated in front of our eyes. So we can talk about like how that we know what that impact is. We can address that. Uh, like I said, we talk about social determinants of health and systemic inequities in the US. It applies everywhere. They are people, we are people. So all of these things are interconnected. You can talk about the issues that you see here, and you can connect it easily to anywhere else. In Gaza, obviously, you can, because their entire infrastructure has been destroyed. There are no social determinants of health remaining there. So you can talk about this. And we have a vision of what it means to work at a population level. Some of us work in community clinics. And we, as healthcare professionals, we carry a certain weight, and we can really effectively lobby, and sometimes against the industry lobbying as well. And honestly, it really makes you feel better about yourself as well when you do this. You have greater satisfaction, whether you're working on healthcare bills here or like related to the global situation. You will just feel better because you will feel that you're making a greater impact. Um, and it also helps improve access. It helps improve the lives of your patients here and abroad. So you will get funding and you will, for obviously services that you require here, but also you will be able to influence what goes outside of the US because we've seen it now very clearly, right? Like they are taking taxpayer money that's supposed to be invested in our healthcare infrastructure, in our social determinants of health, and they're using it for bombs. So yes, this is all interrelated. We need all of that funding for us actually, and it will also save lives in Gaza. So it's all connected, and I really tell you, my position as president is a volunteer. So I will tell you that it is very, very fulfilling to at least be doing it. I also feel very dissatisfied by the current situation, and I feel a little helpless at times. But it is still, like Khaira said, she said a lot of wise words tonight, and she said that it's the effort that you put in that is important. So I can't emphasize that enough. So with that, I'll hand it back to Kamen. And
Okay, awesome. Oh, so sorry. Thank you so much, and it's really interesting to hear. Could you repeat the name of the website one more time for everyone
I'll put it in the chat.
in the chat for the letters that are sending?
Yes,
And
yes.
again, thank you for this empowering testimony as to how we can connect our identities and even our professional identities with the advocacy we do. So we'll go on to our final topic for discussion before moving into questions. Dr. Hala Sheikh al-Islami, I'd like to hand it to you.
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Thank you for inviting me, and thank you for our panelists. I wouldn't say I am anywhere near the activist that you guys are, or I should be, and thank you to Dr. Al-Assad. But what I wanted to share today is the experience I had when I went to Gaza in May. Next slide, please. So how I ended up, I'm not there are a lot of people, a lot of doctors, you may have said they've gone to various places and they may have said that this is the worst place they ever worked. I never had the opportunity to go. Several things happened in fall, last fall. One was I was finishing up a book called Mountains Beyond Mountains, highlighting the work of Dr. Paul Farmer and his humanitarian work in Haiti, and pre-medical school, during medical school, after medical school, and beyond. He's a Harvard grad, infectious disease, and I felt very empowered by what he was doing or what he had done. And then the trigger of me wanting to go, obviously, was October 7th and the aftermath. And then a third thing that happened was the realization that my kids are grown. I don't have any dependents, and I need to do something. So putting the grief into action instead of watching the news, media day after day, and so sad, crying over all what's going on. I'm like, wait, I'm a doctor. I can do something, right? So now I just had to find the means of how to go. Next slide, please. And again, I had to kind of from ground zero find what organizations go, what are the, some that do shorter missions. Can I go as a non-surgical specialist? Can I, doing just outpatient work? And what does it mean to go into a war zone? And I learned a lot from that, and I can talk a little bit more. But next slide, please. I entered Gaza on May 1st, and obviously it has been a transformative, medical mission. I found that I received more than I could give. The Gazans are very resilient. intelligent, innovative, and have very strong faith. Next slide, please. This is the first hospital, Indonesian field hospital in Rafah that I saw. I went with a small delegation called GLIA, and the medical director there was, working with GLIA, and he took us on a tour. And this whole hospital was repurposed to be a orthopedic hospital for everyone who needed, medical attention, prosthesis, physical therapy, being recovering from an orthopedic trauma. And obviously, this is in May, so this hospital no longer is in existence. Next slide, please. And this is the outpatient clinic that I went to, Tel Al Sultan. It was the biggest outpatient clinic in Rafah. From the medical director, he told us the number of visits were about 200 prior to the war, prior to everybody seeking refuge in Rafah. And when I was there, it was at the hub of providing a lot of different specialties in outpatient services, and up to 2,000 patients a day. And unfortunately, when the Rafah border was closed, the clinic dwindled as patients moved out to becoming very much a skeleton of what it was. Next slide, please. And this is another, so I'm talking about innovation, and, here's a tent in the midst of the tents in Deir Rabala area, where just kind of some doctors providing some care for patients who could not travel, and limited resources and medications, of course. Next slide, please. These are my medical, I call them my medical students. These are medical students who obviously the studies came to a screeching halt during the invasion. And so most of them actually went to different places to volunteer their time. Here were several in Tel Al Sultan Clinic, helping out, and actually they served as my translator because I didn't speak Arabic. And so Noor on the right, I spent most of the time, a wonderful young lady who probably has to start over, inshallah, when all this ends. Next slide, please. Several other students who were translating for me. Tamer on the left he was his last year. He had one more year to go, and it's really hard to know what's going to happen. Where can they start? I think. And next slide, please. So this is what we met every day: patients, people living in kind of these, tense conditions, really difficult. And you can say to do it for a few days or a week, but this is month after month, and sometimes they had to pick everything up and set up another place to live. Next slide. I think I have more slides on people living in tents and just kind of very basic conditions. Next slide, please. We also, we were quote unquote displaced. I can't compare to what the people in Gaza went through, but we had to move to the Al Mawasi area, and this is a view kind of that area and the tents you can see from above. Next slide, please. I think the sun is getting, I don't know if you can see me. I may have to move. And in between these tents are these rubbles. This is, remember, back three months ago, and sometimes it was hard to say because at that time there wasn't any attacks, so much in Rafah. So it's like is it from previous wars? What, when, what are these? So in between buildings, there were all these destructions. Next slide, please. And these are people lining up to get water. This is what I've seen mostly as doctors, were kids and adults with water, due to unsanitary water, with diarrheal diseases, hepatitis A, due to living conditions, upper respiratory infections, a lot of skin infections in kids as well. Next slide, please. And this is May 8th. This is when the Rafah border was closed and East Rafah was invaded. As we were going to the clinic, we could see people starting one by one to, unfortunately, for the whatever time, pack up and leave and try to go to a safer place. And I think the next several slides show if you can, another slide, they just pick up and go in whatever they have, donkeys, carts, trucks, whatever thing was at their disposal. So next slide, please. I didn't take a lot of pictures, right? I think of patients on purpose. We were told, just like in the United States, they have their own dignity. So I just didn't do it without their consent. This is, the father did consent, and these two girls were so cute and smiling that I took pictures of these two lovely girls. Next slide, please. And the picture of the sun setting on the Mediterranean Sea was just wonderful. And in the midst of war, finding some inspiration in nature. Thank you. And next slide, please. So what did I witness, right? As I was talking to one human rights researcher, she said that, as doctors, we are doctors by day and witnesses at night. And it's so true, right? Because what we see, what we document, what we can take pictures of, become witnesses for the rest of the world. And obviously seeing families torn apart, seeing families who experience, obviously many deaths, illnesses, displacement, difficult living conditions, war zones, drones. I in one slide that I didn't include here, I had a sound of the drones, and they are so annoying, so annoying. It just gets under your skin. And I was like, wow, I can't believe that Gazans have to deal with this. And they're like, no, this is not just now. This is going on since 2006. So there's a lot of things that we don't know, all the stuff they have to deal with. And then the bombs, right? Waking up in the middle of the night with bombs dropping is not something anyone wants to go through. It's just, and the sad part is that I had a US passport. That was my ticket out, right? And this is not what the Gazans have. And when the border was closed and I was, trying to have a way of getting out, care got involved, my representative, my brother talked to my representative, I talked to her after I came back. So there was a lot of things involved, but, it's sad to know that who speaks up for the Gazans, right? And the last thing, of course, witnessing is that what does it mean to have a total collapse of the healthcare system? I think, a doctor or not, we depend on a hospital if we have an emergency to go there. And what if that's not there? If you can just imagine, what if we had, or family or someone we know had a medical emergency, and the hospitals are either overwhelmed, can't take patients, There's no space, there's not enough resources or medication or labs. I mean, it was just difficult to imagine all of this. And what does it mean to have an infrastructure collapse, right? Again, I have never been in any part of the world where, you know, there is no, you know, we just automatically depend on the infrastructure, someone to pick up the trash, someone to, you know, police or whatnot. And when nothing of that exists, and when you feel abandoned by the world, where this is going on for months and months, you know, it feels like the world has abandoned thousands. Next slide, please. So what we can do is everything that the panels have talked about: being aware, being educated, being active, right? We have to raise our voices. And another thing I wanted to add is to be uncomfortable. We have to be uncomfortable. How can we not be, you know, how can we be comfortable in face of atrocities and genocide going on? So that is part of it. Until Gaza is and Palestine is free, we have to be uncomfortable and do our part. And volunteering, if you can go to Gaza, if you have the means in terms of what you can offer, I would advise you to go. But there's a lot of things for sure that can be done in the US as well. Next slide, please. So my daughters who are older say, Mom, all the young people want to be influencers today, right? What's an influencer, right? So the definition is, you know, a person with the ability to influence potential buyers of a product or service by recommending it on social media, right? That's an influencer. And it's basically marketing, right? You're just selling products for another company and making some money. But what about another type of influencer, right? Someone who affects or changes the way the other people behave. What about influencing us to do something good? Next slide, please. So here is my influencer. You may remember Dr. Hamam Alo. He was doctor and nephrologist at Al Shifa Hospital, and he was being interviewed in Democracy Now! By Amy Goodman, and he says, well, why don't you go to the South, right, where it's safer? And he says, if I go, who treats my patients? You think that I went to medical school for 14 years so that I can just think about myself and leave my patients, you know? And then he goes on, this is not why I became a doctor. I can't leave my patients. And obviously he dies mid-November or he was killed, I should say, in mid-November by Israelis. So to honor Dr. Alo, and all those who have been killed, we need to get out of our comfort zone and we need to stand up for what is right. Thank you very much.
Amazing. So for the short Q&A period, I'll step out so you can see all of our faces. But I wanted to comment, Dr. Hala, that thank you so much. I've seen like a lot of presentations as a medical student hearing from physicians who went to Gaza. And I'm like greatly appreciative of you having included the character of the region and the people beyond just the horrible things happening to them. So thank you so much for that. And thank you for going. That's thank to all of our panelists for the advocacy that you all have done, kind of as like a career, part of your career. It's been really awesome to hear from you. And for this small Q&A session, we're running a little bit over, so we'll shoot for 10-ish minutes. And anyone feel free to ask in the chat. We have a few tallied so far. We'll just kind of bounce around. If anyone feels called upon to answer a question, please go ahead. Otherwise, I might direct a question to one of you all if I feel that it fits you all specifically. I know Hira talked about this a little bit, but I think it would be nice to talk about again. So a lot of people in our community, in the Muslim community, are feeling skeptical about politicians. I mean, me, I was, born as 9/11 was happening and don't have much recollection, but some of the older members of our community speak to multiple events that have distanced them a lot from our governmental structure. How do we remedy that in the Muslim community? I'll leave it to whoever feels called upon to answer.
I guess you asked a loaded question, Kevin. I thought Farah was gonna jump in, but it's fine. I don't think that there's one way to like remedy this. It's talks like these where you speak to the community members and you showcase that, there's still a lot to be done. And I think that being disillusioned from politicians is not a bad thing, really. It's actually the truth. Like a lot of us are feeling very disillusioned. I just don't think that we should allow them to, continue to make us feel bad. We should, that's why the statement Dr. Hala made about we need to be uncomfortable, but guess what? When we are uncomfortable, they are also very uncomfortable because you do understand that they're the ones doing the wrong thing. So they will be extremely uncomfortable. So your discomfort will be minor compared to the discomfort they will feel. I do think that we are at a point that we're disillusioned, we're engaging, we're trying to do what we can. There's always room for more. But I also think that we're at a stage that we need new politicians. So we need to engage newer people like yourself, maybe, to think about like getting into this forum and like thinking beyond like the traditional careers, like thinking about pivoting into politics. Because guess what? Sometimes when you have to fix something, you just have to do it yourself, right? So you can't stand from the outside and keep complaining about it. You have to get involved and be like, okay, I'm going to revamp this. So I don't have a solution, but like these are just like the thoughts that you can have.
I have an addition to this. As the oldest panelist here, I've been I came to the United States when I was young in the 1970s. Kind of shows my age, but nevertheless, I want you to know how things have changed, right? Um, Things that are going on, how people are standing up, the voices. I mean, it's unimaginable. It's slow, right? But I'm imagining what it was like to couple of al-Quds, there were kind of like these demonstrations against Israel that we did back then, and the atmosphere or the amount of people or how many things have changed. It's slow, it's very slow, but it is such a big difference compared to what it was, where you couldn't even utter the word Palestine, really. So just hope, I guess, for the for the young generation, or for all of us, that yes, it is slow, but it has come, and it wouldn't have taken place if we just sat and done nothing about it. Right? Thank you.
Yeah, if I can add, I appreciate what you both shared, Dr. Hada and Dr. Sana. The way I think about it, and Kevin, so my family, they came to the United States in the early 1990s. So they lived through like 9/11 and the fear and all of that. And I was born after like 9/11. So I can't remember what, all that they went through, but I'll say this, like specifically, personally, from like my family, there was a lot of fear. So to address your point about, the Muslim community, I do acknowledge that our community went through a lot of like fear and targeting, the Holy Land 5 case. People are till this day, I think some of them, I'm not sure how many more years of jail they have left, but they got caught because they were literally providing school supplies for people in Gaza. So, and it's a detriment to our system, our political system, you know, having to like loophole us between like either being Democrat or Republican, or this whole conversation around the lesser of two evils. So it is a very, very loaded question. And this is something like I think about all the time, like how do we remedy this? How do we remedy this? And how do we move forward? But I guess just from like October, just like seeing my respective family, like how in the beginning when October 7th happened, I remembered being like completely lectured by my parents. They were like, you know, you have to be very careful, be very safe, you know, don't speak up, don't say anything. And it took a lot of work in my family, like a lot of conversations, taking the time to hear where my family or where the older generation is coming from. Even in the masajid, we've held like listening sessions, just creating the space where people can come together and share their experiences and hear what they went through. And I'm like a firm believer, like we need the wisdom of the older generation, but at the same time, we need the energy of the younger generation. And I'm not saying the older generation does not have energy, but you just kind of need that, you know, like we're out on the streets, we're doing what we have to do, blocking roads and all of that. But we also need the expertise of the older generation. So to answer your question, I think in like from like my personal perspective as Khaira, I think to remedy this around the conversation around fear or like, oh, our impact is not enough. I really think the first step is just like stepping over that fear, like addressing why are you afraid. And if that means that, you know, your family had the FBI, you know, knocking on your doors, like that was so normal back then. So it is definitely a point of like contingency. So I would say like having conversations and like being open to different like, you know, perspectives, and then also like acknowledging our success. I feel like the Muslim community, like there's a lot of wins that we've had that our community is not acknowledging. It's just like, oh, we have to be doing more. Yes, we have to be doing more, but we have come such a long way. So I would say like my thing to remedy this is just finding a way to balance that fear and to like get over the fear and address the fear. And then also you have organizations such as CARE, MLFA, Muslim Legal Fund of America. So if you're ever in these situations, know that you have people to support you behind your back. Like you literally have these organizations who are here to support you pro bono. I know like this is what CARE does. This is what MLFA does. So there shouldn't be any fear. That's like my biggest point that I'm trying to say. And then ultimately, like, you know, we have Allah. I think that's like something special about our community is that we have someone who is protecting us. Like he is seeing all of this. So this is why it's very important to know your rights and your responsibilities and to know what's being offered to you. And oftentimes the American system does not want you to know your resources, so that you are put in these positions of like, oh, I don't know how to move forward, or I'm scared, or I can't do this. They want you to feel hopeless. So don't give them the chance to feel helpless and hopeless. Hopeless, yeah.
I appreciate this wisdom from you all a lot. Awesome. And moving into another question, Dr. Sayed, if you feel comfortable answering this one, the question is, how is healthcare advocacy different from political lobbying and partisan campaigning?
Oh, sure. So, healthcare advocacy is agnostic of the candidate. So it's even if, like, for instance, by chance, it's possible that when at least the Democrats pretend to support, you know, more equal access and pretend to expand access to healthcare, um, it sounds like it's democratic, but really it isn't. It's completely agnostic of the candidate putting it forward. You may very well end up supporting a Republican bill, but just because it allows for greater access to healthcare or to housing or food insecurity. It's completely independent of the party proposing it. Lobbying is like lobbying becomes like it's more organized in the way that they sometimes it's directed towards particular politicians. So, and it's directed towards influencing something like the industry, For instance, well, I am in the pharma industry, so I see it from that side too. I'm not in that space, I'm more in research, but like they will pick the bills that will benefit them and they will lobby to ensure that those get passed. So, like as a nonprofit, these healthcare access bills have zero impact on me, obviously. So like it's therein is the difference. It's the that kickback that you get that is absent for advocacy that you do. But if you're coming at it as like the NRA has a lobby, right? That's why we have so many school shootings in this country and so many dead children. So that's lobbying because they want to sell guns no matter what. And advocacy is more like we don't, well, of course, some of us may have family in Palestine, but like for others that may not have that direct link, it is more because we don't want the loss of life. We are humanitarians. It is just wrong, right? So, and even if you have family there, it doesn't count as lobbying because it's just common sense, right? So it's more, lobbying is more like a monetary like advantage that it's introduced by influencing policy.
Thank you so much for the clarification and also the anecdotes about your work. I kind of wanted to ask a question, maybe for myself, maybe. But the question is, what roles can students have in making positive changes in healthcare and governmental policies? So, Dr. Hala, I know you talked about Dr. Paul Farmer, who did work as a student. Hira, I know you are a student. Uh, Anyone is invited to answer this question. And inshallah, we have time for a few more or one more after this.
Um, yeah, I mean, obviously you're doing it right now, right? You're doing it as a student. You're being active. You're getting involved. And you can do so many. Actually, I'm talking tomorrow, probably the same talk with the Stanford students, and yes, so you can go to one of these mission trips as a non-physician, right? They do want you, once you have your certificate, one of the things you can do as a student is finish your studies, then you can go to all these places. But before that, there were some who, even in our little delegate, who were non-physicians, but they were doing logistic work, but they got to see up close and what was going on in Gaza, right? We had this male guy, he was American Hispanic, and then he came and just kind of did the logistic works, and was very much an activist, a non-Muslim, right? A lot of non-Muslims were in Gaza. I think there were probably of the people who came, foreign delegates who came, majority were non-Muslims than Muslims, right? And from all over the world, but so you can do this. You can, as I said, you can join and you may with global health programs in your school. You can host students, not students. You can host students, and you can also help in bringing in children. Yeah, we have Heal Palestine, bringing kids in to that need medical care. So there's a lot of things you can do depending on time, energy, effort, etc. So, and again, as one of the doctors said, one of the best things to do is to finish your studies, so that inshallah you can do lots of medical humanitarian work.
Yeah, I think when it comes to like students, and honestly, this goes to anyone, but my first comment about like specifically students, like of course on your campus, like getting involved with like your Students for Justice in Palestine, like that's a non-negotiable. But I would also advise like getting involved in like student government. That is very, very important. actually, I was having this conversation with a dear friend today, and my school, it's a public institution, but there's a large majority of Muslims. So many of the students gravitate towards the MSA, which is amazing and wonderful, creating that community. But we also need our Muslim voices and representation to be within spaces where, there aren't many Muslims. And to me, it's like, there's a majority of Muslims within the school. It's very important that we have people within the student body who are making decisions for us as students, or just being involved with the administration. So I would say, like, I guess my piece of advice is, in addition to like being supportive and involved with your MSAs and your SJPs, step into other roles such as like student government. Because within student government, you have direct access to the administration, direct access to the president of the university. So just kind of think of different ways you can branch out into other communities where they wouldn't see Muslims or people who share our same beliefs and values. So that's one thing. And then another thing is, don't underestimate your voice within the classroom. Like last semester, I was in an infrastructure class. And we were talking about current events. In everyone's current event update, no one mentioned about the complete destruction of infrastructure that we're seeing in Gaza. And I was appalled when it was like 2 weeks. And then after 2 weeks, I like raised my hands and I was like, either I'm living under a rock or you guys are living under a rock. Like, we're all on social media. There is like mass destruction in front of our eyes. This is something that we need to discuss about. And then as soon as I initiated that conversation, people in the classroom felt comfortable and compelled to start speaking up. So whether it's in your workplace, whether you're an engineer, you're a doctor, like there is a way to interconnect with what's happening in the world. So like, don't be afraid to speak up. And you never know that maybe you might be that first person who speaks up. You might make other people feel more comfortable to speaking up. So I would say like that's my biggest advice with like students. And try to put yourself in uncomfortable positions where you're talking to people who might have never heard the Palestinian or the Muslim or the Arab perspective. And then also like my biggest advice is like, give people benefit of the doubt. I know it's so difficult, but some people are genuinely believing the propaganda that they're feeding into them. So just kind of keeping that in the back of your mind is like being patient with people when you're conversing with them. And yeah, just giving them a chance and to not be afraid.
Thank you all so much and for these great ideas too. Personally, things I can share with my fellow classmates. Since we're getting a little late, especially for folks on the East Coast, I thought it could be cool to close out maybe with one or two sentences of any final thoughts from each of you, if you feel called on to give final thoughts. I'll give a few moments.
I just want to point out that somebody put the definition or the difference between lobbying and advocacy in the Q&A, and I think it's a more accurate definition, where lobbying is more about telling a politician to oppose or vote towards a certain bill, whereas advocacy is more explaining where what your position is on using data and your own experiences. I guess it's a little bit of a gray zone when we talk to folks, because frankly speaking, we do use certain bills and explain why we think those are the right way to go. So it's I guess it's the lines are a little grayed, which is why I thought that since we don't get any benefit from it, that's probably why it's not, because none of the nonprofits can actually lobby. We mostly just advocate. So just to be clear. I don't have any additional thoughts. I think the conversation speaks for itself, and thank you, Kamal, for your great leadership in this. Go ahead.
Thank you. Yes, Kamal. I think my closing thought is we are in a very, and I say we are seeing history unfold in front of our eyes with the genocide, right? And to answer to Allah, to answer to family, to answer to our kids, grandkids as they grow up, is like we, you know, we have to be comfortable to say, what have we done when there was genocide going on? And yes, there's so many things we can do. Everybody can do their part, but to just be comfortable with the answer you can give yourself. When I saw genocide, I lived through genocide. This is what I did, and be at peace with that.
Yeah, and this is just like a minor thing. I would say don't do it. You're not alone. Don't do it alone. There is community. And like find your community. I would say that's the biggest thing. But I would not advise to get into advocacy and do it alone and like set up a meeting on your own and talk alone. No, don't do that. You honestly might not get anywhere. So it might be a little bit harder, more difficult to like find that community, but know there are people who want to work with you. And honestly, just start with your masjid first, or your workplace, or your school. So don't do this alone. Do it in community.
Thank you for today's panelists for sharing all this important information, and especially lots of words of encouragement. Thank you for everyone for attending, and we hope you learned. We'll be posting this and the slides online. And yeah, let's call it. This was amazing. May peace be with you all, and have wonderful nights, and stay strong in these times.
I'm like,
Walaikum assalam.